Warm greetings. I am Dr. Shwetha, Senior Consultant, Department of Ophthalmology, United Hospital, Bengaluru. There are millions of people in the world who are suffering from diabetes. Diabetes affects all the parts of the body and so it affects the eye also. In the eye, diabetes can cause loss of vision due to various conditions like it can give rise to spectacle problems, they can develop cataract, there would be a raise in the eye pressure which we call as glaucoma, and also it affects retina which we call as diabetic retinopathy, which is the most vision threatening complication due to diabetes. Why we should know about the diabetes? Since the diabetic patients are not aware of correlation between the high blood sugar levels and the eye, some of the patients who are referred for eye tests due to diabetes deny for the screening as they feel that their vision is absolutely fine. Some of the patients are unaware of the comprehensive eye examinations which includes a part of retinal screening where they can find out about retinopathy changes. Some of them are guilty because they have uncontrolled high blood sugar levels, and some of them are scared of the complications. So today I thought I will educate these diabetics the importance of eye tests annually and how can they avoid diabetic related retinopathy complications. What exactly happens in the retina? Retina is a layer in the behind part of the eye which takes the images and transfers these as signals to the brain, and so we see the objects clearly. Due to high blood sugar levels, like any other part of the body where the small blood vessels are affected, even in the retina the small blood vessels are affected. The lining of the small blood vessels are affected, so there will be leakage of the fluid or blood into the retina. These blood vessels lining are so damaged, sometimes there could be obstruction of the flow in the blood vessels, so a particular part of the retina is not having the blood supply. Due to which, as a defense mechanism, there could be small abnormal blood vessels growing on the surface of the retina. These abnormal new vessels are very fragile, they break and give rise to bleeding into the middle part of the eye, which we call it as vitreous cavity, and we call this as vitreous hemorrhage. Initially, there could be no symptoms, but when there is bleeding or when there is accumulation of the fluid, there could be decrease in the vision, there could be dark spots, there could be floaters. On long-standing hemorrhage or bleeding inside the eye, there could be a raise in the pressure in the eye which damages the optic nerve permanently. Sometimes these blood in the vitreous or in the retina can organize as fiber bands and they pull the retina, which we call as retinal detachment. And these retinal detachment, glaucoma, that is rise in the pressure due to bleeding, all these are severe vision threatening complications of retinopathy due to high blood sugar levels. So how do we treat it? Initial stages, when there is just edema or swelling in the layers of the retina, or very early findings, just tight control of the blood sugar level is enough to avoid complications. Suppose there is bleeding in the retina, sometimes your ophthalmologist can shoot lasers to burn these abnormal vessels or leaky vessels, so can avoid further complications. There are injections available which we give inside the retina, that is into the eye, to seal or avoid further complications or to avoid growth of the abnormal vessels in the retina, which we call as anti-VEGF injections. If the stage is severe hemorrhage or there is retinal detachment, surgical modality is the treatment of choice, where we do a procedure called vitrectomy. By performing this, we are removing the blood in the vitreous jelly and if there is a retinal detachment, we try to attach the retina. The surgical results are not very great, not very fruitful. These are done only to avoid the further complications of the eye and not to restore the already lost vision. Who are all at risk to develop diabetic retinopathy? Any patient, whether it is a type 1 or a type 2 diabetes, can go for a retinopathy complications in the eye due to uncontrolled sugar levels. They say longer the duration, that is duration of the disease of diabetes, higher risk factor to develop retinopathy. Any patient with diabetes having comorbidities like blood pressure, high cholesterol levels are prone to develop retinopathy. A diabetic pregnant lady is also at a risk for developing retinopathy changes. And the patients who are diabetics having habits of alcohol or smoking can also develop diabetic related complications in the eye. So what should we do? The best way, as everybody says, prevention is better than cure. So how do we prevent retinopathy changes, or how do we prevent retina getting involved due to high blood sugar levels? So the simple rule is annual eye examination. So every diabetic patient should have an annual comprehensive eye examination, which also includes retinal screening to see the diabetic retinopathy changes. So this is the simple rule that every diabetic should go visit their ophthalmologist and have a detailed eye evaluation. Other than this, keeping your blood sugar levels under tight control, avoiding complications like keep your blood pressure and cholesterol level into control, and have good habits like avoid smoking and alcohol, a healthy lifestyle, a good balanced diet, and exercise, moderate exercises. All these are simple measures to avoid the complications which happens due to high blood sugar levels. We at United have an expertise team of physician, diabetologists, ophthalmologists, and a dietitian who can help you to avoid diabetic related complications not only in the eye, in all the parts of the body. So I would thank United Hospital to have given me this opportunity to educate diabetic patients to take care of the eyes. Thank you.